Hello there. Today, we're going to tackle a topic that so many people face, but it's often, really misunderstood. We're talking about cancer pain. And our goal here is to transform what feels like this huge, overwhelming challenge into a clear, manageable plan. This is all about shifting from fear to empowerment, so you can focus on what really matters, healing and living your life.
Let's just start with the single most important message right up front, because this one idea, it changes everything. It's the foundation for our entire conversation today. Getting good, effective pain management isn't some kind of luxury. It is an absolutely critical part of your cancer care.
So how are we going to get there? Well, we've got a roadmap. We'll start by really understanding the pain. Then we'll learn how to identify it, explore some powerful treatments, build out your medicine toolkit, cover safety, and then we'll bring it all together into one complete management plan. So let's jump in.
All right, first things first, we have to define the challenge. Knowing exactly where the pain is coming from, well, that's the crucial first step to getting a handle on it.
It's so important to realize that pain isn't just one single thing. It can come directly from a tumor that's pressing on bones or nerves. It can also be a side effect of the very treatments that are designed to help you, like surgery or chemo. And sometimes it's not even related. It might be another condition that's just made worse by everything else that's going on. And this complexity is exactly why a one-size-fits-all approach just doesn't cut it.
And that leads us right to our next point. Because pain has all these different sources, and also has different personalities, you could say. And giving a name to what you're feeling makes it so much less of a scary, abstract thing. It gives you and your care team a shared language to really figure things out.
Okay, so the first big difference is time. You've got acute pain, which is kind of like a temporary alarm. It has a clear cause, maybe from a surgery, and it gets better as you heal. But chronic pain, that's different. It's persistent, it can last for months, and it requires a much more strategic, long-term game plan to manage. Now let's get even more specific, because describing the type of pain you have is so key. For instance, if you're feeling a deep ache or a throbbing, that could be bone pain, which happens when cancer is affecting the bones themselves. Or maybe what you're feeling is more like visceral pain, that squeezing, cramping kind of pressure you get when tumors are pushing on your internal organs.
And then there's neuropathic pain, which feels completely different from the others. We're talking burning, tingling, or even an electric shock feeling from irritated nerves. It is absolutely critical to identify this type because it usually doesn't respond to standard painkillers. It needs specific medicines designed to calm those nerves down.
So, now that we can start to put a name to the pain, let's talk about one of the most powerful tools we have to fight it head-on: radiation therapy.
Think of radiation as a highly targeted weapon. It works by shrinking the tumor that's causing all the trouble. So whether that tumor is in a bone, pressing on a nerve, or squeezing an organ, radiation can reduce its size and relieve that pressure. And often, you can start feeling that relief within just 1 to 2 weeks.
Now, it's also really important to know what to expect. As the radiation starts doing its job, it can sometimes cause a temporary pain flare or some skin irritation. A lot of the time, this is actually a normal sign that the treatment is working. Your team totally anticipates this, and they have a plan to manage it, so you're never caught off guard.
Okay, let's get into the heart of your day-to-day strategy, your pain medicine toolkit. And this isn't about just one pill. It's about a smart, coordinated system designed to give you relief.
The core of this strategy is a brilliant two-part system. First, you have your continuous release or long-acting medicine. Think of this as your foundation. It provides steady, around-the-clock relief. Then, you have your immediate release or short-acting medicine. This is your rescue team. You use it for those sudden breakthrough pain flares to get them under control fast.
But the toolkit doesn't stop there. For that nerve pain we were talking about, there are specific meds like gabapentin. You might also have anti-inflammatories to help with swelling, or even bone-strengthening drugs that pull double duty by also reducing bone pain. It's a true multi-tool approach, tailored just for you. So, having the right tools is one thing. Using them effectively and safely, that's the other half of the battle. Let's switch gears and talk about strategy, because how you use your medicine is just as important as what you use. And this brings us to the single most important rule of pain management. If you remember one thing, let it be this: stay ahead of the pain. This means you take your long-acting medicine on its strict schedule, even if you're feeling okay. The second you feel that breakthrough pain start, you use your short-acting rescue dose immediately. Don't wait. By tracking everything in a diary, you and your team can spot the patterns and perfect the plan. This is how you stay in control, proactively, not reactively.
Of course, whenever we talk about powerful pain medicines like opioids, a question naturally pops into your head, right? What about the risks? What happens if there's an emergency?
I love this way of thinking about it. Think of Narcan like a fire extinguisher. You really hope you'll never have to use it, but just having it on hand keeps you safe. It's not a sign of danger, it's a sign of preparedness. It's a tool that can rapidly reverse an opioid overdose, and it's an empowering part of your safety plan, there to protect you, just in case.
All right, let's zoom out for the big picture, because a truly effective plan goes way beyond just medicine. It's really about supporting your whole self. Think of these as your allies in pain control. Physical therapy can keep you moving safely. Things like acupuncture and massage can ease tension. Relaxation techniques and counseling can help you manage the emotional weight of pain. And you should never, ever underestimate the power of good nutrition and sleep. Each one of these helps your body's ability to cope and to heal.
And finally, let's cover the absolute critical red flags. We're not talking about your daily pain tracking here. Any of these symptoms, sudden weakness or numbness, losing control of your bladder or bowel, severe new back pain, or slowed breathing, that requires an immediate call to your care team or 911. It's absolutely essential that you know these signs.
So we're going to end with a call to action. You now have the language, you have the framework to be an active, empowered partner in your own care. So think about it. What is the first question you are now ready to ask your care team about your pain plan? Your journey to conquering this pain starts with that very conversation. Thank you for being here.